Today's Ask the Doctor segment is all about prostate cancer and other issues. Dr. Austin Lutz from Brookwood Baptist Medical Center here to take your calls. Call us right now, 741-9272 to ask your question. And I just want to start out with, Dr. Lutz, I've heard it said that any man, if he lives long enough, will probably come up with prostate cancer or some issue with cancer.
Certainly. Well, prostate cancer is very, very common. About 1 in 6 men will actually be diagnosed with prostate cancer. And, the question is whether this is going to be a clinically relevant prostate cancer that we're concerned about and would need to treat, or whether this is a prostate cancer that's really insignificant. So that's sort of what we're trying to differentiate. Okay.
We've got our first caller, Donald from Indian Springs. Donald, what's your question? Do we have Donald?
Yes, we have Donald.
Go ahead, Donald. What's your question?
Well, thank you for taking my call. I had a PSA of 3.9 a couple of weeks ago, and my urologist decided to do a biopsy in January because I have a strong history of prostate cancer in my family. Mm-hmm. And what I want to ask you, I forgot to. I didn't think to ask my doctor, but since it's below 4, just barely below 4, but below 4, do you think they might not find cancer?
They very well might not. I think certainly family history is very important to be thinking about your age.
I'm 64.
64, okay. They very well may not find prostate cancer, and I think, a prostate biopsy would be something to consider depending on what your other PSAs had been. Certainly above 4.0, we'd start to think about that. So,
it's never been above 4, but it's been acting funny lately.
Yeah, well, if there's an acute elevation, then it may make sense to go on with a prostate biopsy, and certainly you don't have a 100% chance by any means of having prostate cancer.
Yeah. Well, I appreciate you talking to me.
All right, sure. Thank you, Donald. Let me follow up. When should a man start getting those PSA tests, and how important is it for them to get those?
So it is very important. As far as PSA testing goes, there are different sort of cutoffs for people who would have a higher chance, like family history, African-American males, certainly around 40 to 45, potentially a baseline PSA. Certainly for those men over 50 to 74, there's been screening trials that show, particularly in Europe where there was a much nicer study done, that there is some clinical benefit and overall mortality from PSA screening.
Now, is that something they need to do every year, or is it every 5 years?
It's a great question, and there is some debate about that. Currently, some guidelines would suggest every year. Others suggest actually every other year, because potentially some prostate cancers may not be growing or may be slow growing during that time. Currently, I think most practicing urologists are really doing about every year for that age-specific category, or much older guys who have a long life expectancy.
And one last question: what are the symptoms? Are there things that a man will know something's going on here?
Well, there actually aren't, unfortunately, and that's one of the beautiful things about PSA screening, is that before that we had men who came in with gross blood in their urine, they couldn't urinate, they had bony pain. Well, those men had advanced or metastatic prostate cancer at that time, and so PSA screening has helped us reverse when we find men, and so it's really that number which is so important and really tells you when we could do more molecular testing or MRI testing or other adjunct testing to decide what to do next for a man.
Early detection important for all cancers, but particularly for this one.
No doubt.
Dr. Lutz, thanks for being with us. We appreciate it.